just so pleased with the group that's going to present today. I wanted to, mention how important it is to have employment. It is a major therapeutic tool. It's an indicator of wellness, and it is required now for the upcoming Behavioral Health Services Act. It's in the requirements for Behavioral Health Services Act as well as the Behavioral Health Connect to provide what's called individual placement and support, which is a model that you'll hear about from the speakers. And it's required in all of the counties. Small counties don't have to do it to the fidelity level of reporting and tracking information as the other counties, but it is required throughout California. So let me hand it over to Danny Marquez to make some opening comments. And then we have speakers from different counties who are either providers that are community-based organizations or county employees. Danny?
Yes, thank you, Teresa. Good afternoon, everyone. Caswell would like to thank Teresa and all of you for giving us a chance to share our thoughts and experience on a key tool in expanding employment opportunities for individuals with behavioral health issues, Individual Placement and Support, or IPS. As California moves forward toward the implementation of Proposition 1 and Behavioral Health Connect, you will hear from 3 programs today that will give you excellent ideas on how IPS is implemented by public agencies and 2 community-based organizations. We hope the information we share will help you overcome any barriers and/or challenges the many California counties may see as they are planning, programming formats, funding options, and service delivery for vocational services. We also hope each of you will see how the implementation of IPS will create employment opportunities for individuals we serve in California. Our presenters today represent 3 counties, and as they each speak, I'll let them introduce myself, but we tried to get a good range of geographical areas. And so we'll begin today with a presentation from Amanda Downing from San Diego. Amanda?
Hi, everyone. I have sharing capabilities, correct?
Yes, that's correct.
Share. Fantastic. Hi, everyone. Good afternoon. My name is Amanda Downing. I am down here in San Diego, currently sunny despite our June gloom. I am currently the program manager for a program called TURN, formerly known as Mental Health Systems Employment Services. We are a DOR contract providing IPS support to county mental health consumers. I wanted to start us off today with just a little bit of an overview for some, an introduction for others to what is IPS. So I'm going to go ahead and share a couple of some short and simple slides. I'm not going to throw a lot of text at you. I'm going to kind of talk through what the model is and our 8 key principles that we start every IPS conversation and training with. Chris also put this in the chat, a document that refers to these, which you can also look over as a reference either during or later. So let me go ahead and share my screen. All right, does everyone see a slide that says, what is IPS?
No.
No. Let me try that one more time. How about now?
Yes. Yes. Yay.
Fantastic. And I also just want to say I am recovering my voice. I lost it entirely after coming back from vacation. I don't think it was due to the road trip with my kids in the car, but you never know. So I want to start off with just what is IPS. So as explained, the acronym stands for Individual Placement and Support. It is an evidence-based practice that comes with a fidelity scale. And it was intended and continues to support employment and education goals of those with mental health challenges. Current and past research also supports applying it to other populations, TBI, IDD, autism spectrum, and others. Any and all information about IPS you could ever want can be found at ipsworks.org. That is sort of the mothership of IPS for the IPS Learning Center. So the model really got started in the 90s. It was about the 1990s. I feel like we need to specify now. It was a transition to get job seekers out of day treatment programs and out of sheltered employment and into their communities and into competitive work. And we'll talk a little bit about how IPS defines that in a moment. It really emphasizes, like Teresa said, employment as a key component of someone's wellness and about employment being an intervention for someone's recovery and wellness, not just an outcome. So we want to be focusing on employment alongside other goals and sort of prescribing employment alongside other therapy modalities and other interventions. Research is ongoing with this model, and just want to emphasize that repeated random control trials continue on to prove the efficacy of IPS over traditional approaches. So I just want to quickly go over our 8 key principles that we start off every IPS conversation with. Apologies for those that this is a review. I think if you're around IPS enough, these sort of begin to get sort of branded on your brain. So we always talk about a focus on competitive employment. IPS really emphasizes competitive employment as being not time-limited employment, not set-aside employment, not transitional employment. It's paid at least minimum wage. And when I say not set aside, it's not set aside for a person with a disability. So we're looking at competitive work environments, a job that any person could apply for. It is employment that is paid for by the employer, not by monitored by an outside agency. We always talk about with programs the concept of zero exclusion. So this really talks about how we want any participant of a provider to have access to employment services, no matter where they've been or where they are today in terms of their wellness journey or their employment history. Oftentimes we hear people say that, we also hear the phrase, well, that person's not ready for work or not ready for employment. And we want to take that sentence out of people's vocabulary. We want the question to be, do they want to work, not are they ready for work? Every IPS specialist knows about benefits planning, so we know how to refer someone to a trained benefits counselor because we want to make sure our job seekers understand how their benefits and employment can work together. We never want a job seeker to think that we're there to, put their benefits at risk or take away their benefits. We want to make sure that they understand from a trained benefits specialist how employment and their benefits can support that job seeker, and supporting someone and understanding that employment is going to get them more financially ahead than staying on benefits in the long term. We follow a rapid job search model, and I like to emphasize here that it's rapid job search, not rapid job placement. So we do get started with the job search activities right away. Sometimes this does lead to rapid placement, sometimes it doesn't if we are being more particular or we're looking for that really specific placement, that really following really specific preferences. But we do get started on the job search very quickly. We don't spend a lot of time with assessments. We don't spend a lot of time with work readiness skills or assessments. We don't ask people to achieve certain milestones before they begin their job search. We are really getting going with that job search right away. That job search is done following a systematic job development approach where IPS specialists or employment specialists are going out into the community and speaking with employers directly for the purpose of building relationships with those employers to do a good match between our job seeker and that employer. So we want to make sure that the needs are being met on both sides, that we're building relationships with employers And the purpose of those visits with employers are not just, are you hiring? And it's not just, what is your hiring process? It's there to learn information that isn't included in a posted job description and hopefully build a strong connection so that employer sees the employment specialist as a resource. Recently, one of my staff was visiting a local nursery, and they didn't have an opening at the time when during her first visit or her second visit. And before she could go back a third time, that the manager at that nursery actually called my staff person and said, "Hey, we just had someone quit and we would love to work with you to fill that position." So it's about kind of building that connection and being seen as a resource to help employers meet their hiring needs, at the same time making sure that we're connecting employers that are going to be the best fit for them. We do all of this while benefiting from integrated support with our mental health providers. So the employment specialist is part of the treatment team, and congratulations, treatment team members, you're part of the employment team. So we want all the employment specialists, the prescribers, therapists, case managers, peers, we want everyone to be on the same page, talking to each other, know what the goals are, supporting better engagement and better outcomes for services for our job seekers. We are also going to make sure that our job seekers know that they will be receiving job support, not just job search assistance. So job supports mean that we are there to help people get the job, and then we are there to help people keep the job. We want to make sure that we're working with family members, working with natural supports as much as we can to provide maybe supplemental support, whether it's work, school, both. We want any supporting individual that job seeker has, that when they transition from a job seeker to an employee, that they have support available beyond the meetings with the employment specialist. We want to make sure that job support plan really is individual and it is dynamic, that we are bringing in other providers' support, natural support, to ideally get that job seeker now employee to a point where they don't need us anymore. I like to say employment specialists we're always trying to put ourselves out of a job, right? We don't want people to need us anymore. So we want to build in those layers of support and skills so that they can move forward past our support. What's important about IPS is that we don't set a time limit on that support. So we're not saying, okay, you get that support for 30 days, we get that support for 6 months. It's really up to that individual person to say, I don't need this support anymore. Please stop calling me. Right? Like sometimes people just are like, I don't need to talk to you anymore. And that's great. And that's what we're always hoping for. We want to make sure that person knows that it's their call when they don't need that support anymore. And then if you haven't already tell from the name of individual placement and support, we are all about the individual job seeker. We are listening to their preferences at every stage of services. So from our initial getting to know you period, where we do a career profile to get to know them as a person and get to know their employment skills, strengths, and preferences, and their day-to-day activities and interests, to their job search and going out and talking to employers with or without them, going forward to those job supports. We are listening to the job seekers as the experts on themselves to know really sort of how, what, where, when, and sort of why these services and supports happen. So that might mean, frequent conversations around disclosure. It might mean, updates to that conversation around benefits. It might mean, frequent communication around those job supports. We want to make sure that our job seekers feel supported and feel heard and have a strong guiding hand in these services. I often like to think of our job seekers being in the driver's seat and we're kind of GPS, and that if they want to reroute, then we will reroute. And if they punch in a new address, new location, then we're kind of going along with them and providing information and resources along the way. I'm going to go ahead and take a break from talking now and pass it along to the next speaker. Danny, could you remind me who is going next?
It's Adelia, I think.
Okay. Hi,
And
everyone.
I might, Amanda, if I might interject, I might even
Yeah, go for
say,
it.
yeah, I might even just kind of open it up to the group right now. I think we
Oh, yeah.
kind of hit folks with a fire hose of
I
information,
did. I'm sorry. If anyone has
Yeah.
questions.
I have a
I
question.
think we have some questions. Let's go in the room first and then we'll go to the ones online.
Thank you so much. I absolutely love this idea as a clinician, knowing that there are clients out there who could definitely benefit from these services. I was wondering what qualifies somebody for these services and who is the lead on the team? Is there a lead?
Chris, you want to take that one?
Yeah, I can jump in. So, in order for somebody, in line with the practice principle here and the zero exclusion approach, in order for somebody to be eligible for services well, basically they have to meet specialty mental health criteria for one, but besides that, a person's stated interest in wanting to, it's super low barrier. Like if somebody wants to go back to work, that's all we need to hear. And we can start engaging, folks immediately in what that looks like, for them.
Perfect. And
It's
who's
as simple as that. Yeah.
awesome. And who is the lead out on the teams?
It really depends on the staffing pattern and the team structure. It can range from like if you're working in a smaller county and you don't have that many teams, let's just say you have one FSP program. Typically, what that would look like is you would have an employment specialist on the team, and then that person would be reporting directly to whoever the team leader or the program manager is. So in that sense, it's a little bit of a challenge because the team leader then has to wear kind of two hats. They have to be aware of, IPS and the practice principles and know, what the requirements are as far as, monitoring certain key performance indicators of the supported employment service and the requirements of the ES, because the employment specialist, that job is a lot different, looks a lot different than, a typical clinical case manager. When you think of the employment services specifically, and you think about the full service, like the team as a whole, the employment specialist is always going to be working with a subset of the folks who are open to that service, right? So part of the model for IPS is there are relatively low caseloads. So the program participant to employment specialist ratio is a 20-to-1. So ideally, we don't want to see caseloads larger than 20 per 1.0 FTE employment specialist. And that really enables the employment specialist, like Amanda was saying, when we're looking at the practice principles, like being really person-centered and really being able to get to know that person, what their strengths are, what their skills are, what their interests are, as well as what their challenges and their barriers are, which is a big divergence from, a lot of traditional voc rehab programs. When you think about that traditional approach where you may have like one, employment vocational specialist, but they've got, a couple hundred people on a caseload. It's really hard for them to provide that very individualized, person-centered service. So the team, think of a team of, let's say there's 100 people, on a team. The employment specialist would be working with 20 folks at any given time. So the team leader would have to kind of wear those two hats, like managing the full caseload, but then also being able to, to spend time and attention on that subset of folks who are receiving that employment service as well. And that 20 at any given time, I just want to emphasize that is very much a dynamic sort of like caseload that the employment specialist is handling, because folks come through the door, and we talk about like stages of change. Somebody may come through the door and is just like raring to go. They're super action oriented. They're focused. They have a goal. They know what they want to do. They may even tell you like, I know exactly where I want to work. I want to work at that Home Depot right there on Main Street, which makes it really easy, right, for the employment specialist to kind of go out there and start immediately contact employers. And then you might have some folks that are interested and say, yeah, I want to do this. And the employment specialist has capacity, but it's still very much, an exploratory process. We've got to figure it out, what it is that they're interested in, what they've done in the past, what's worked, what hasn't worked. They may still kind of be on the fence, about really kind of wanting to go back to work. So we've got to unpack kind of what's behind that. The biggest reason why folks are reluctant, the studies have shown to go back to work is their fear of losing benefits. So that's why, one of the core practice principles that, Amanda shared is that everyone who has access to this service will also have individual specialized benefits counseling, because everyone's individual situation is a little bit different. We may have folks who just have SSI. We may have folks who have a combination of SSI and SSDI. They may have housing subsidies, right? SNAP benefits, any program or entitlement that is means tested. We want to make sure that the program participant is sitting down with a benefits counselor. We can talk specifically about their situation. So it's, because the world of benefits, we're talking federal level benefits, state level benefits, local level benefits that all have, they're very complex and all have their own rules and regulations and thresholds. So it's really not, it doesn't make much sense for the employment specialist to have to stay on top of all of those rules. It really makes more sense to connect with a certified work incentives planner to provide those specialized benefits counseling.
Thank you so
Yeah,
much.
thanks. I'm going to stop on question just for a moment. I want to make sure to give Adelia a chance to speak, and also mention we have a link to our issue brief that's included in the materials for today that goes over, the second page talks about some of the benefits and concerns that people have sometimes keep them away from even seeking employment, which we don't want to happen. We want them to understand that there are ways for them to keep benefits and work. So Adelia, do you want to comment on this topic?
Yes, thank you. I'm Idalia Matthews. I'm the former program director over at Interim Incorporated for Employment Services. I recently stepped into a new position, and I'll be honest, when I first heard of IPS, I was like, I don't know about this, and my former supervisor purchased books for us, and Chris put in the chat ipsworks.org. There is some information on there. You could purchase books. There's a lot of free information also available. You could also print out the fidelity scale to see where you are with your program. And we do that on an annual basis. But when we started looking into IPS, it's like, wait, we're doing that already. Wait, we're already doing that. We're already collaborating with the county. So even though we weren't able to embed and be in the same offices as them, they still attend their treatment team meetings on a weekly basis. The job development was one of those things, the 6 employer contacts that the staff have to do on a weekly basis. That initially was a challenge for them to be able to find the time, but with the smaller caseload, it does help. And then I also had a lot of introverted staff. So it's like, how can I make this work? So paired them up together. Let's do it. Let's go. And Chris actually provided a training to us in Alameda County years ago, where we went and we talked about the 3 cups of tea, how to engage with employers. So as Amanda had mentioned, you want to learn more about the employer versus are you hiring, because you're going to say, yeah, go ahead, apply online, and you're not really going to build a connection. So it's about feeling comfortable and building a connection. And if it's a mom and pop store, maybe they're going to hire just their family until they get to know you, right? And so we have had jobs here around the area where they've been like, you know what? I'm going to give you a chance. You come in here. So I had one employment counselor that was going there at least once a week, made friends with the owner of the restaurant, and he gave his client a shot as a dishwasher. And so we want to build those connections, whatever it might be, going in there, even if it's buying something small, whatever it might be, but building those connections and making sure that the staff feels comfortable. But there is a lot of information on the website, and a lot of the things that we were already doing was like meeting people where they are, connecting them to the benefits counseling, really making sure that we were always collaborating with the county. But then the things that we weren't doing was the things like the job development, like the 6 employer contacts. So that was a big challenge, as I mentioned. And then we were already collaborating with the county, but we weren't going to their weekly team meetings. So we started doing that and implementing that. And then also reviewing our fidelity scale on an annual basis and really sitting with the team and really breaking it out into 2 sections, because you can really, where did we improve, or how can we improve on this? Where have we, you know, fallen short? Because we want to make sure that we are providing services to fidelity. The one thing that has been challenging, I will say, is that rapid job search, and not so much because we just have, you know, a lot of people waiting to come into the program. And so I would say that really structuring and meeting people where they're at, if it is because with our program, for instance, opening them to Department of Rehab, we're not always able to open them as quickly as we'd like, but we're going to meet people where they're at. And at that very first contact, we're going to provide them job leads. Where is it that they want to, maybe that they're looking at the job leads and, oh, that one looks interesting. And if they want to apply, we'll help them apply. So meeting people where they're at, so that maybe by the time that they are already opening to Department of Rehab, they might already have an interview. Sometimes they already have a job, and that's okay, because the goal is to help them get there and to help them find employment.
Great. Yeah, thank you so much, Adelia. And she mentioned the Department of Rehab. So that is something that you know, the counties will be hopefully collaborating and creating memos of understanding or relationships with all of the DOR offices and and contractors throughout California. So it's not just behavioral health. It is complicated putting together these programs. On the DOR side, Department of Rehabilitation has the vocational counselors and, you know, a lot of knowledge about employment. And then on the behavioral health side, they have, you know, the piece of understanding the needs of people with mental illness and having all of the different providers and staff. So integrating and collaborating is so important, and it is complicated, and it's complicated with funding as well. Did either of any of the presenters want to comment at all on barriers or challenges that you wanted to maybe have the boards and commissions bring up to their counties? Or if you just want to kind of give them a directive to say, encourage your counties to get this going?
Do it, jump in and do it. I don't know, maybe just kind of like a word of advice. So like, this is a very, you know, dense, you know, information, but I think, you know, when we boil it down to the 8 practice principles, I think so long as you align as an agency, as a system, you know, if you align with those core practice principles, you know, predominantly, like, you know, are we person-centered? Are we strengths-based? Are we possibility-minded? Like, you know, not know how, like, if that's how we are, then like uptake of this model is going to be, relatively easy. It's just a matter of jumping in and doing it, but within your respective systems, right? So we have a number of years here to implement, you know, to fidelity, right? The next 3-year plan, there's no, you know, strict requirements around fidelity, but starting in 2029, you know, the state is going to expect all of the FSP programs to have not only IPS, but, you know, sort of community treatment and other evidence-based practices. The good thing is that the IPS Employment Center, right, the mothership, Amanda called it, and the links that I put in the chat there, these are the folks who developed the model, and they have been named as the Center of Excellence for California. So, you know, over the next 3 years, they are going to be rolling out training and helping, you know, with technical assistance and implementation. But in the meantime, you know, I would look, you know, I would encourage counties to implement like on a measured basis. Like, I put the fidelity scale, I put an implementation plan, and I put the IPS agency readiness checklist in there. And that'll just really help you think about, like, who are those providers, who are those teams within our respective systems of care that are just like stellar, awesome.
Mhm.
Like when we talk about person-centered planning, strengths-based, like they are already with that business. Like it's not going to be a tough sell. Identify those programs and those teams and think about, as if we're going to implement, as far as planning this out, start with those teams first, right? Start with the folks who are going to have, who are going to have buy-in, the folks that are curious, the folks that are willing to change, things and change up the ways that, services are delivered, what the staffing pattern looks like, sort of organizationally, the ones that are able to shift and that are nimble and that embrace, new things. Start with those agencies and those programs so that you can demonstrate success and then build upon that and then start scaling out more and more and more, so that by the time, year 3 rolls around, we've kind of scaled out. We've got year 1, year 2, year 3. That's sort of like the advice that I would give. Because in Alameda County, we've implemented IPS since 2010, and that's exactly how we rolled it out. We started very small with 1 county operated program and 2 CBO agencies. And that was through an RFP process. So we had some seed money that was involved, and we said, hey, we got this new model. We want to try this out. So we had them, apply for this money, and we were able to fund employment specialists, and we laid it all out. We provided the training. And then, we were able to demonstrate the success with those programs and then slowly scale out from there.
Great. Okay, thanks. Amanda and Adelia, I want to give you a chance if you have any final closing words.
Yeah, so here in San Diego, we say IPS yes, trademark pending. We want like Chris said, we want a chorus of champions. Solos are great, but we want it to be loud and we want people to hear it. So identify your champions and then just keep adding to that group to amp up the volume. And I do just want to say, make sure that your champions are coming from all the different levels of practice and service. We want executive leadership, we want external leadership, we want direct service providers, we want peer supports, we want family members, we want service consumers, we want everybody's voices as part of this conversation. And also, I do just want to kind of repeat what Chris said a little bit, to start slow and grow. I think that is maybe one of the things where San Diego, I think, maybe got a little bit too enthusiastic about IPS and sort of had implemented so many programs at once that it's been, everybody just trying to keep pace. And so definitely starting slow and grow, starting with what you do well, doing sort of a crosswalk between what you're doing currently and then transitioning to IPS. The program that I'm currently with, we're a 30+ year contract, and we've only been doing IPS for the last 5 years. It's been a work in progress, and really the first several months, if not year, was just really about identifying where are we already doing this, but maybe calling it by a different name. What are we changing or updating or shifting slightly? What's sort of our incremental implementation plan? So just because you say okay, now we're doing IPS, doesn't mean you have to start doing the full fidelity that next day. Really think about, okay, what does our implementation plan look like? What are we hitting first in terms of fidelity, and what is our sort of our 1-month fidelity goal and our 6-month fidelity goal? And when you do sort of that baseline fidelity review after about 6 months, you're really just aiming for that baseline fidelity, right? That think about getting 3s, maybe not necessarily 5s on every single one. A 3 on the fidelity scale means you're doing the model, and you can get a 3 on each of the items and get a fidelity score. You are doing IPS if you get a 3 on each of those items. And then you have room to improve and room to grow. So I think it's just thinking about, it's not everything all at once. And I think providing that education and support to folks involved so that they don't immediately go, it's too much change too fast. And thinking about how how and who is sort of leading this change effort.
Thank you. Adelia?
I just want to really emphasize how much it really does work. I know that for the county, we have program outcomes, and once we started implementing more of the elements of IPS, we saw a jump in our numbers. And so, and then clients, I mean, they're more likely to reach out if they need support. We have people that still keep in contact with us years later, and they're still employed. So it is very helpful to have that as a model.